Time for Back to Life, brought to you by Southwest Spine and Pain. A 30-minute conversation with their board-certified physicians about how to live life again, pain-free.
Welcome to Southwest Spine and Pain Back to Life show. Our host today for the next 25 minutes is Dr. Jared Dupre. And he's going to be discussing integrated pain management.
That's right. Happy to be here.
Oh, so glad you're here. Let's talk about that. What does that mean when you talk about integrated pain management?
So integrated management in general in healthcare is the idea that we need to integrate different aspects of not just how we treat, but also different professionals and work together to treat whatever's going on with the patient. It's much more collaborative. It's also much more effective. We also find that the research shows the physicians are much more satisfied in doing what they do as well as the patients. So it's a much more effective way to treat healthcare in general, especially pain.
And Dr. Dupre, can you give us an example of how you've done that, or I know there's a lot of different aspects of this and different functions, but can you kind of walk us through the steps?
Yeah, typically we have an actual separate location in St. George called Southwest Healing and Wellness. It's a sister site to our Southwest Spine and Pain clinics, and that's where we actually engage in the integrated care specifically. And typically what happens is we engage in a full evaluation. So when we evaluate, we're looking traditionally at the pain condition and the various physical aspects that contribute to that. But in addition to that, we're looking at fitness, nutrition. We're looking at emotional health, mental health. We're looking at the relationships. We're even looking at things like career, finances, all these pieces of our lives that impact us. And I don't know, surprisingly or not to some of you, but all contribute to our pain. And then as we evaluate, we customize a plan based on all the professionals and resources that we have there. So we have a team of professionals and a team of various services that go outside the traditional approach to pain management. And every person's different, obviously. And so that plan may lead to doing some oxygen therapy to help the fibromyalgia, which is in a hyperbaric chamber. We have a Qigong class in the back there. We have a full Pilates yoga looking type of room where we have instructors that specialize specifically in pain that can help them go through the movement that they might not be able to at a typical gym. They may engage in either counseling or wellness coaching to look at their life balance and look at their eating habits and their fitness plans. We may bring in a physical therapist or fitness specialist to help them work through a plan that helps them actually get the fitness that they need while considering the pain conditions that they have. We may do amino acid therapy, which is something I'd like to talk about today at some point, which is kind of a unique way to nutrate the brain to address things like energy and focus and mood and pain. But all those things we do is customize based on the person, and as we treat, we follow up obviously and adjust, and we find that once again it's much more effective and it's a much more enjoyable experience.
Wow, that covers a lot, doesn't it? I mean, it's a very extensive program that you have.
Yeah.
And that's wonderful because, if a patient comes in, they have fibromyalgia or they have a challenge with, pain, and at the same time, they're kind of at a physical, their physical their physical fitness has kind of lost a lot of the, maybe muscle mass and things like this. And so if someone comes into you, okay, so I guess what I'm trying to find out a little bit more succinctly is so our listeners can, kind of tune into this and think, well, I wonder if this applies to me. I wonder if there's something that I have that he could help me with. So what kind of calls do you get when you have patients come in? Yeah,
no, that's a good question because a lot of people think I need to have a chronic pain condition to come in. And obviously people that do have a chronic pain condition we can treat fully, but pain comes in various shades and forms. And when we talk about pain, we're not always talking even just about traditional pain. I mean, even people that have emotional pain like trauma, that has been shown to have a great impact on physical body as well. So a typical call, they vary. We could have someone like today. I mean, I treated 8 or 9 patients today, and they all vary. And one had trauma, a couple had depression and anxiety, several had fibromyalgia, several had accidents that led to obviously chronic pain conditions that led to lifestyle changes, which have impacted their life satisfaction and mood, and they're kind of stuck, not sure how to live life, not planning on that type of thing happening to them, To be honest, some people have come in for, this may surprise people, for things like weight management, because weight impacts pain and the way we handle pain quite a lot. And oftentimes the thing getting in the way of someone really alleviating the pain long term is addressing weight, not from not the numbers and the scale, but more from how can we help your body be as healthy as possible to be able to heal and address the pain that you have and move and all those types of things. So, yeah, I had several patients today that came specifically because they wanted to lose some weight to help them address their plan. We can address all those things. That's the neat thing about integrated care, is because we're looking at it from more of a whole person perspective, really any presenting problem we're able to address. And if we can't, we know people in the community that can. So we end up becoming the quarterback. I actually can't think of a single person that's ever come and said we don't know what to do. We always have some answer for either in a house or someone in the community, because integrated care goes outside of even just Southwest Spine and Pain. It's working together as a community and having teams and other clinics and things that we work together with. We do that quite a bit. So really anything that has pain from emotional, physical, mental, even spiritual perspective, or a health condition that impacts the pain, we can address.
Okay. Wow. It sounds like there's so many different elements that you're able to either address and be able to help, or you find a solution for them somewhere else.
Yeah, I'd say 90% of the time we can do things in-house. But I'd also say 90% of the time we're using professionals outside of Southwest Spine and Pain, working with them collaboratively. That's true integrated care. Is none of us can do everything perfectly or all in the same place, and we know kind of who are the best in the certain areas, and we reach out to them and they reach out to us, and we address this as a team.
So who is a part of your team within your integrated, like in your offices? Who's part of that team?
Well, we obviously have the physicians. Dr. O'Bray is actually our medical director at Southwest Healing and Wellness. So he's the liaison between the medical group and our group, which once again we work together. We also have Britt Christensen, who's a physician that's in charge of rehabilitation. And so that includes, the physical therapies, occupational therapies, and other things we can do there. We have Alberto Sousa. He's actually a new provider. He's a nurse practitioner, but he specializes in psychiatric care too. So if people have mood disorders or anxiety or depression or adult ADHD or lack of energy focus, even things that contribute to fibromyalgia that are coming from a neurological perspective, he's able to address that either through psychotropic medications, which we kind of view as a short-term approach for most, and for some a long-term, but mainly a short-term approach. And he also helps with amino acid therapy, which is another way to address neurological conditions or symptoms in a more natural way.
What did you just say?
Amino acid therapy.
Amino acid therapy.
Yeah.
Can you explain that a little bit?
Yeah, there's not very many people doing that here in southern Utah, let alone Utah. The idea behind amino acid therapy is there are neurotransmitters or neurohormones in the brain that basically tell different parts of our body to do things. And we know some of them are pretty popular in commercials and news and stuff like that. So serotonin impacts mood. So if serotonin's low, people are more likely to have depression or anxiety. Or norepinephrine is usually attributed to ADHD, or dopamine is usually attributed to addictions and things like that. But there's a whole bunch of them. GABA impacts stress, endorphins impacts pain. They're all different mechanisms that impact how we address the different physical parts of our life. And amino acids are the building blocks that make up these neurotransmitters. And so if serotonin is low, for example, that's going to contribute to someone's likelihood of having depression or depressive symptoms or low energy, that type of a thing. Traditionally, how people have done it is we've used SSRI, selective serotonin reuptake inhibitors, or other medications to kind of give them a short-term approach to helping the serotonin stay in their system longer. Serotonin reuptake inhibitor basically is blocking the vacuum that sucks the serotonin back up. And so it doesn't really create more serotonin. But amino acids, if you can give the right amino acid that creates the serotonin to the brain, then it'll actually create more. And so it's a more long-term solution. It's basically feeding the brain what it needs to increase that neurotransmitter with very little side effect. And it's pretty immediate. I mean, amino acids will work in 20 minutes, so you can tell very quickly if something's working or not, whereas the typical medication can be anywhere from a week to 3 weeks. And often those come with side effects that can be difficult. And once again, we're not against psychotropic medications. They can be useful when used in the right way and the right timing and everything. But amino acid therapy is a really good alternative or additional resource for people dealing with various things. And it's also pretty good for younger people because there's less side effects too.
How do you take the amino acid? I mean, what?
It's not a medication. It's not a prescription. You can get it at like Fusion Pharmacy or Dixie Nutrition or nutrition
across
stores. It's like taking vitamin C.
Okay.
But you take like 5-HTP is a common one you'll hear of, or glutamine, which a lot of bodybuilders and people take for joints, but people don't know that's an amino acid. So you can use that for people to regulate sugars. Actually, I used this not too long ago with someone with type 1 diabetes, and it regulated their sugars almost immediately. And so, there's lots of ways to use amino acids. What we do is we can actually assess you to see what neurotransmitters you're low on, and everyone usually is on some level. But it's not something you take your whole life. You usually give it to them
for a short period of time.
8 weeks, 3 months. And then usually you get to the level, and then usually a regular diet will maintain it.
Well, that's interesting. I know this might be a simple question, but how do you go ahead and assess someone with the neurotransmitters?
Yeah, you just
ask what process is it that you do? Ask them questions, or you actually have machines, or?
Yeah, no, it's easier to ask them questions because we can tell pretty quickly based on the symptoms, and also food cravings actually help us understand it because, for example, someone that craves a lot of ice cream at night, doesn't mean you're this, but if you have that combined with other symptoms, you're likely low on endorphins. So people with pain, for example, their endorphins will get hammered all the time because of their pain condition. And so they'll crave certain foods that raise their dopamine and endorphins, and ice cream's one of those, so they'll usually crave ice cream at night. So if you give them, for example, D-phenylalanine, which is amino acid that raises endorphins, they'll actually stop craving the ice cream and also be able to manage the pain better. So a lot of people
will also help the weight issue.
A lot of people use amino acids for weight.
Oh, that's interesting.
Yeah, there's a good book. I mean, I'm not trying to promote this person. I guess I am now. Julia Ross wrote a great book called The Craving Cure, which is, you can find at Barnes & Noble or anywhere else, but it's a bestseller that talks about how these cravings are signs that your neurotransmitters are low, and she gives kind of some general guidelines on how to use amino acids. But we've received advanced training from people that have trained under her, and we're actually able to specialize in assessment of amino acid therapy needs. Once again, which can be very helpful in a very immediate way. So what would you? And this is all so enlightening. There's so many different facets of this. Yeah.
What would you like the listeners to know about what you can do or what your team can do for them?
Oh, I forgot to tell the rest of the team. I should probably say that, right?
Okay.
Yeah, I'll tell you real quick. I was telling you about the team. So we have Alberto Sousa, then we have Lori McBride. She's a social worker, so she's in charge of a lot of our clinical needs, like counseling and group counseling. And we also have biofeedback and neurofeedback that we offer there, which we could talk about too if we want. Kevin O'Keefe is our clinical psychologist. We have Dr. Matt Eschler, who's also a behavioral health specialist. We have various people on our team that help with the yoga, Pilates, Qigong classes, and we have a stretching class. It's pretty neat for pain. And then myself. So that's our team.
Well, that's quite a team.
Yeah.
So what would you like to tell the listeners in the next few minutes about if someone is when someone is listening and they're thinking, I wonder if I fall into these categories, what's the next step, and what are some of the symptoms that we can talk about?
Yeah, I've kind of put people into 3 camps, and we can help all 3. We just do it differently. So I'm going to start on the severe side. So someone that has been using opioids or opiate-type medications for a long time and has unfortunately gotten to the point of addiction or close to that is at risk. We are licensed for intensive outpatient and day treatment services, which basically the state's given us the license to use integrated care to treat addiction, which we're probably the only one in Utah. As far as I know, I don't know of anyone else doing it that way. So anyone with addiction needs, and we actually get requests all over the country. People can come here, but we want to support St. George and our community in Utah, and so we very much want to reach out to those needing those types of services. And what we can do is do an evaluation of a person that might be in need. So you're not signing up for anything, but we can see if any of our services would be helpful. And once again, if we don't have the right service, we can find it for you. And so that's one thing that's really important for us. There's so many, Utah, I think, is still the 7th highest in the opioid addiction in the country, with multiple deaths a month and even daily. It's a big deal in Utah and in our community, and we want to be a resource for that for sure. So if someone needs help in that, please call us. We can help there. And
what's your phone number, Dr.?
Yeah, our phone number is 435-218-7778. That's 435-218-7778. Or you can visit us at SWSHWC.com, which stands for Southwest Healing and Wellness Center. But the second camp is people that have a pain condition. They're not addicted to anything, but life isn't as good as they like it to be anymore because of their pain condition, and they recognize that pain medications alone probably aren't going to do it. And so you'd be surprised at how much help we can offer and get someone back to a lifestyle that's really good. And people are surprised at that. And so people that have a pain condition, fibromyalgia, chronic pain, acute pain, where they're wondering if life could be where they'd like it to be, we can help there for sure. And then I think the other camp that a lot of people don't realize we can help with, and I've kind of alluded to this, is people that just want to improve in wellness. And because we have such neat resources that are directed to pain, that actually applies to people that just want to improve in wellness in general. So weight management, mood, ADHD, focus, energy. I had several sessions today of executives in the area that just want to improve on life balance and wellness. I mean, it's just something to where we have so many resources, and at our disposal, we can put together a pretty good plan for someone that wants to just improve their wellness in general.
So is that the third camp, or that's that part of the second camp?
That's the third camp in my mind.
Okay.
Yeah. So the first 2 camps are people that really have a pain condition. First one being those that have gotten to the point of addiction. The second one, they're not addicted, but they have a pain condition. And the first, they don't necessarily have a pain condition, but they want to improve in wellness because of the resources we have. We can help with that.
Okay, so there's 3 things that you can help with.
Yeah, 3 areas, yeah.
And, okay, that's great to know. All right, so is there anything else you'd like your listeners to hear and understand about what you can do for them? Or maybe even, I know you mentioned a few of the people that you saw today. Oh, I know, I was going to ask you something else too. Is this available under an insurance plan? Okay, this is all under insurance?
So it depends on the insurance and what your deductible is and things like that, but most insurances will cover some, if not all. We also we have Medicare coverage, which is unique. We also have a lot of people will use their health savings accounts too. That's a more popular
The flex plan?
Yeah, the flex plan.
Flex plan.
Yeah,
Okay.
that will definitely cover these services. So, depending on deductible and things like that, there's different ways to look at how to pay for the services.
Okay.
But we're very big on trying to adjust to your needs. And
Okay.
so if there's a financial concern, we're going to figure it out.
Well, thank you. I appreciate that information too. So, can you walk us through a patient that you've had, without giving names or too much, but what the symptoms were when they came in, whether it's a few months ago or years ago or a few weeks ago, and the progress that person made in the end, and what their life is like after they've gone through the process with you.
Yeah.
Or your team.
I actually just finished one today. I started seeing them only 2 months ago. So once again, I'll change details of this to protect privacy and everything. Yeah. But in general, this person came in for anxiety. They came in for anxiety to the point where they're having panic attacks. Come from a well-to-do family, professionals in the community, happy family, no significant events really impacting them too much. She tried various medications. She'd gained weight because of the medications over the years, and that impacted her ability to exercise, and also impacted pain. So lower back pain, knee pain, things like that. Her motivation's down, so it impacted her how she ate, and she'd emotionally eat sometimes, that type of thing. So you can see, even though originally she came in for a pain condition, it's really much more complex than that. And really the pain is really a symptom of other things. So we actually helped wean her off of her anxiety medication and gave her amino acid therapies, which we got a follow-up today that's totally working. She said she said, quote, "This is a game changer in my life."
Did you say this was a treat? What kind of a treatment did you say?
Amino acid therapy.
The amino acid.
Yeah, we did that, and we actually had her do some counseling, and we also did some wellness coaching to help her develop a fitness plan, an eating plan, and address some of the stressors in her life. And I'd say 2 months ago she was at a 2 or a 3, and I'd say she's probably at an 8 right now.
Oh, that's wonderful.
Yeah,
that must be a great feeling of satisfaction knowing that you can see the progress of someone that really is very desperate when they first come in, and you have been able to assess the situation and be able to direct her, and as part of the team efforts, and be able to help her recover, or at least from a 2 to an 8. That's quite a jump.
I think that's probably the one thing I want people to know is I don't think they realize how much we can help. You hear all these things all the time, but it's very rare to have a good integrated team that can come together and make a significant difference quickly. So that's what I'd like to know. One other thing I'd like to let people know is we can do Zoom, which is a webcam-based service. So if people live in rural areas, we're actually able to see people throughout Utah in any rural area over webcam.
Oh, you can? Mm-hmm. Okay.
Yeah.
That's great. So those people that are not nearby or out in the, in the surrounding communities can have an opportunity to get through to you and be able to be helped.
Yeah, absolutely.
Thank you so much. And we so appreciate Dr. Jared Dupre being here with us today. And you've just been listening to Southwest Spine and Pain Back to Life show. If you or your loved one is suffering from pain or discomfort, call Southwest Spine and Pain at 435-656-2424. Thanks for joining us. Tune in each Monday evening at 5:30 for Southwest Spine and Pain Back to Life show.
Join us for Back to Life every Monday at 5:30 p.m. here on St. George News Radio, where board-certified physicians from Southwest Spine and Pain discuss different alternatives to live life again pain-free. For more information, go to southwestspineandpain.com.
Ever have one of those moments, just turning your head, putting on your shoes, or even just a sneeze or cough makes you double over in pain? At Southwest Spine and Pain, we see it every day. The moments might be different, but the reality is the same. Pain. Our team of board-certified physicians delivers solutions with state-of-the-art medicine, equipment, and technology like stem cell therapy. Our goal is getting you pain-free. Call us at Southwest Spine and Pain today. 435-656-2424 or southwestspineandpain.com.